Before we get going, I wanted to do a land acknowledgement. I am located in Ottawa-Gatineau area, which is the site of Algonquin territory, which covers both Quebec and Ontario borders, and there's an active land claim in the area, which has not yet been settled. And in addition to that, there's actually a condo development happening on Victoria Island, which is kind of a spiritual center for the Algonquin people. And that has been contended to. So it's just a reminder to all of us that these things are very much alive, and the land acknowledgement is a way to kind of remind ourselves, I guess, of these issues as well. So before I go on, I want to indicate that this is based on a paper that was done by me back in 2014, and it talks more broadly to useful approaches to the governance of Indigenous data. So it was about Indigenous data, but what I'm giving you now is just a piece of it, and hopefully we can get into a lot of the stories that have to be told about some of the great data initiatives going on are actually stories to be told by their... Okay, perfect. Okay, off we go. So this is, as I was saying before, is a shorter part of a much longer paper. And I'm really happy that Sume was in touch with me to present it, because it means that it's been, I think, of kind of use to the health information community. And I'm really delighted, too, to see all the practitioner people who are on the line right now, because I think I can learn a lot from you as well, just the kinds of challenges that you're having or the kinds of initiatives that you've come up with in order to try and institute a data governance regime, or not. So I think that's one of our poll questions. So one of the first, just next slide, please. Perfect. These slides, these quotations on this particular slide try and give different kinds of slants on why you would want to think about data governance. And they're taken from 3 different kinds of contexts. The first one being a corporate context, which I should add was the initial area that thinking about data governance and information governance came from. It emphasizes the uses of data as an organizational resource. Data that are relevant and accurate and accessible and auditable and enhance the performance in an organization, whatever it may seek to do. So this is the first quotation from Panion, who was one of the early sort of thinkers about data governance. The second one, which you can also read yourselves, around it. The second is from the health context, and it's from a website of a course that's actually being offered at the University of Wisconsin on data governance. And it indicates why it's important to the healthcare sector in particular. You want to have the right information at the right time, accessible in the right format, so that you can make business and care decisions. So there's a sense in which data governance can really help to improve the availability of data when and where needed. And then the third quotation is from the report of the Royal Commission on Aboriginal Peoples. And that one gets to a little more of a foundational issue about data itself, the notion that the gathering of data, even the creation of data, the gathering, or the categories by which data is organized is inherently political. And this becomes very important when you're thinking of people who are marginalized, such as Indigenous groups. And Aboriginal people, although masses and masses of data have been compiled about them, have historically not been consulted about what information should be collected, or who should gather it, or who should maintain it, and who should access it. So that gives us a sort of fundamental reminder that there is a political aspect to data and data governance as well. And I think as a roadmap of what we're doing, we are going to be discussing very briefly the what and why of data governance and 3 different models, this notion of hierarchies, a partnership, or data commons. And then finally some considerations in selecting the models, and 3 examples then taken from the area of Indigenous health. And I would invite you for more information on these stories, which, as I said, they're not necessarily mine. Hopefully at some point you'll be able to have some guests describe them themselves. I will just point out some really interesting initiatives that have involved Indigenous, the relevant Indigenous peoples in the governance of the data that involves them. So those are the things that we're going to be doing. Next slide, please. Okay, here we are. What is data, or what are data? And essentially, they're descriptive, right? They describe attributes or properties of something. They can be qualitative or quantitative information. Now, data kind of elides into information by, from what I've understood in my reading, that there's less interpretation. It's more sort of, it's raw, it's more simple form. But there's a sort of slide from data into information. So sometimes people use the two interchangeably. They talk about information governance or about data governance. Data tends to involve, a large mass of particular information. And less, arguably, interpretation does occur in the creation of the knowledge, but at the same time, there is still an interpretation as to what data has to be collected and why it has to be collected. Turning to governance, I think that Sume already gave a really good explanation of what governance is in itself, so I won't get into it much, but I will just distinguish it from management in the sense that it really involves focus on the steering, the directing, and the roles and the controls involved in a particular data set, whereas the management will involve more detailed discussions of the processes and the IT information. So once again, there's a sort of slide, as with data and information. There's a slide of governance into information management, and with the former pertaining more to the steering of the data, and the latter on just the general day-to-day use of it. So data governance in itself provides an overall framework for decision rights, roles and accountabilities, and concerning data. It involves structures, standards, policies, processes, and technologies. This is PANIUM. The technologies being the sort of base, like, what's possible, I guess, with the data. The structures involving things like, the governing bodies. The standards would be the things that these bodies develop, and the policies and the processes as well, aligning into the management. Now, I think that we did have a question that we had on our poll. Yes, exactly. Is the governance of data and information a pressing issue for your organization? This is just a sort of relevance question, whether it comes up often in whichever authority you're working on, or whatever organization you're working within. It's important to know, too, there's three kinds of actors involved in data. It will involve producers, users, and governing actors. So the producers of the data, the users of the data, and who happens to be in control of the data, all of these can be in the same organization, or they can be across multiple organizations. And I see that we have 82% of respondents saying that governance of data and information is pressing for your organization, and about 20% saying so far that it is not, or is that no vote? We can get probably from Sume, we can get a 80% in any case are saying that it's important. So that's good. It's good to know that you think about this and that it's important to your organization, because one thing we know for sure is it's going to happen anyway. Governance, it's like Sume said before, this is kind of like the way we do things. And the way we do things, sorry, we'll move to the next slide, please. The way we do things can be done well or poorly. It can be done consciously or unconsciously. You can have, a box in the corner with files that are loosely organized that you cannot access easily, you cannot use. Nobody knows how they work except for one person, and I don't know how often that happens, but it's a possibility that it's done in that way, but it's not a very helpful way to an organization. Or it could be done consciously with some structures put in place that will help to ensure that the data is a useful resource, that it's available, that it's accessible to those who need to access it, that it's relevant, that there's a system check, on the, like, is this data that we have, is it useful to us? Should we be collecting something else? That it's reliable information, it's high quality, and that it is secure, that privacy is protected. And I know that would be a very, very big consideration in a health context. As for business drivers of effective data governance, once again, this original literature is coming out of the corporate sector, and these are the kinds of considerations that were raised on the slide. All the advantages that can happen through effective data governance. You have, greater revenues, lower costs. You can make sure that you're compliant to government auditing requirements, et cetera. It takes a little bit of translation. I think that's occurred actually since some of the work that I did, to other sectors to think about what the advantages are to them. So in the health sector, you could use good and quality and relevant and accessible and secure data to help improve your policies and services. You get a better, more comprehensive view of your clients and of patients. You can reduce costs by increasing the efficiency of your service, eliminating redundancy, especially if somebody else has a data set that would be helpful to yours and that you could engage in sort of a sharing agreement. And you can also ensure your compliance, and you can do it more efficiently and productively to, ensure that you're meeting government regulations or you're meeting auditing requirements, et cetera. So this is also applying in your context as well. And you get better information overall. You get information that can support your strategic goals and your overarching vision. It helps you to make your case, to tell your story in a way that's defensible and evidence-based. So there's a lot of advantages to trying to put some thought to what kind of governance, data governance systems you want to put into place. And then from these systems flow, hopefully, the management systems and the information technology that you need as well, so that you're not just sort of beholden to a client, a potential supplier who comes by and says, well, this is a great system and here's why you need it. You have a real sense of what IT system you need based on the strategic needs of your organization. So whenever data governance, turning to the next slide, here's the rub. Whenever data governance involves more than one actor, then you get questions of ownership and control. It's a simple thing when it involves only the one organization, but as soon as you go outside the organization, then you have questions of, okay, who owns this data, who controls it? And to be honest, in a health context, you probably have that question a lot of the time, because patients themselves will want to see, will want to access their files, they'll want to know what's being kept about them, that questions of ownership and control will emerge sort of de facto in a lot of the work you do. Next slide. So in these situations, or in any situation, there are three kind of dominant models that I have proposed can be used or thought of for the organization of data and the governance of data. And these three, simply put, are like a hierarchical kind of model, a partnership model, or a data commons model. And the diagram at the bottom of the slide provides a kind of basic orientation to the data governance models that exist. And it also gives some, which I will get into as well, some sort of stations on the way, some intermediary models that still resemble one or the other in key ways. Now in the middle, where you see the line on the diagram there, that is the point at which there would be co-governance of the data. And anything to the right of that point still implies the ownership and the governance of the data by one organization, and anything to the left of it involves like a sharing relationship, a co-governance kind of relationship. So on the one pole, you do have a single organization with full decision-making control and full ownership of its data. That would be the data hierarchy. On the other pole, you have a data commons, which is a shared use platform designed to maximize opportunities for use and exchange. So think of something even like, Wikipedia, or that was one of the initial ones, but there are many, many examples of that as well. And in the middle, you have a partnership, which could be a formal sharing relationship among selected partners for mutual benefit. And this will feature shared decision-making about the use and control of the assets, of the data set itself. And between it are these grades where you have one model giving way to the next without yet becoming it. So I think that Sume was describing before a governance situation where you have a consultation, you have an engagement with the community, where you want to have their advice and their input, and you may or may not use it. You're not sure as the person being engaged with whether your advice is being used. It's been solicited in any case. The control remains in the hands of whoever it is who's solicited the advice. So in that case, we're still within the realm of a hierarchical relationship with regard to the data. So next slide. Okay, just a little more detail on each of the kinds of models. The single organization data hierarchy, once again, it features full control of the set. The central case here is a bureaucracy. It could be within a corporation. It could also be within any other kind of organization where you have top-down direction of the data. You have top-down development of the policies and structures. So, for example, it would be perhaps a committee within a board that would be devoted to the data governance or the information governance and management, and they would be developing the policies that the board would then approve, and then the structures and processes would be put in place on the basis of that. The data governance supports the institution and its institutional needs, and there are relationships with other actors. Sometimes even the data can be held by other actors, but it's on behalf of the owner, and it is sort of for their use. So even though there may be another manager, it's still owned by the one organization. And data sharing likewise occurs at the sole discretion of the organization. Now there are advantages to this. It's this kind of default model, to be honest. It can be implemented with relative ease, and the data that is collected is tailored precisely to the institution's needs, and it does maintain secrecy and security around the data set. But there are also disadvantages in the sense there are questions about transparency quite often. There's been a broader movement to governance and to more transparent and inclusive governance that would suggest that you would want to include other actors, certainly community members, the communities you serve in the governance of their data. And there have also been issues of public service failure actually resulting from not sharing data. And the prime example that's often given in the literature is 9/11, when certain institutions were not talking to each other, they were not sharing information with each other, and there was a system failure that way, that there was information that was very vital in order to come up with a shared solution that wasn't shared. So that is some of the disadvantages of the hierarchy. Turning to the next slide, we get to the data partnership. Now this model is moving along that continuum I showed you earlier towards the center. What defines it is the notion of shared decision-making around the data set. And this goes further than just an engagement of stakeholders or even an advisory body, an advisory committee to the data owner. And public service organizations have begun or do engage in these kinds of partnerships as well. It avoids the consequences of lack of coordination, and it also can improve the information that you have about a client, about a patient, right? You get a sort of rounder view by sharing across organizations with one another. It features horizontal governance, fairly formal agreements through MOUs, through data sharing agreements. Parties were relating to each other as equals within the relationship as co-governing partners. And there has to be a sense, though, and this is an important feature of this model, there has to be a sense of mutual benefit. And remember, too, that it's actually easier to have a single organization hierarchy. And there has to be a real sense on the part of the sharing parties that they will be mutually beneficial, that there's a good reason to share this data, and a confidence on the part of the owner that the data will not be misused, or the one that's doing the sharing. So it takes leadership in order to put these kinds of arrangements in place. It takes trust building, it takes time, it takes like a formal agreements generally with clarity of roles. Because once again, the default position is often this sort of closed hierarchy. Okay, the commons. This is our last model, and this, if you're thinking about that spectrum again, the diagram, it's down on the far end towards the left. And this, the classic example of this is a research community. And you can have a virtual network or a community who is actually actively seeking to exchange data and information to maximize access to that information, and in order to do things like, advanced knowledge and advanced science in that area. There are still ground rules, though. There is still governance in place. There are conditions for individuals or organizations to sort of enter into this forum. And then there are basic rules that are in place to prevent abuse of it. There are sanctions against misuse of the data. Often, though, unfortunately, it comes into play, these sanctions, after it's been abused. So there's the retroactive element of it. And ownership, it's important to note, too, the issue of data ownership and control of the data never goes away, also not in a commons situation. It still is subject to arrangements of users and producers by license to use. There's sometimes fees involved. There's agreements in any case. This is how the data will be used in this kind of context, and you have to agree to that in order to access it. So that is the third basic model. And I think we had another poll question at this stage. Yes, slide 36. Which type of governance model prevails for your organization? It would be interesting to know in your health, largely health organizations, which prevails. And whether you have sharing agreements too would be, I should have added that as a question, but. And in some cases, too, you will have, of course, total control, total ownership of one data set, but maybe are sharing another one. There's going to be differences depending on privacy rules and laws, et cetera, and other factors. Okay. Looks like most people so far are involved in a hierarchical data governance model. That's interesting. So we got about 70% involved in a data hierarchy, whereas 29, 30% would be involved in a partnership of some kind. And that's interesting finding in itself. I guess it would kind of reinforce the idea that it's actually, it's easier, it's lazier to some extent. Sometimes it's more effective as well to be to have full control and ownership and use of the data in one's own organization. But from a health equity standpoint, we might want to consider situations where partnerships or commons or some of the data could be made open data as well. Okay, so I guess we'll close the poll and go to the next slide. Let's just take stock briefly of what we've addressed to this point. And I'm happy to field more questions or observations when we're finished. And I see that somebody's also shared some information on how they've been working towards a model of sharing in Manitoba through a collaborative data portal, which was created in partnership. So we've had so far some basic definitions. We've spoken of the purpose of data governance and the components of it. We've introduced a spectrum of models with intermediate stages. And so then comes the big question, which model to use? So next slide. Yes, it depends, right? It depends what you need to do, what the purpose is of your organization and of your considerations to share the data. So one of the main purpose when you're thinking of any given data set or that needs a governance organization around it is the default is not sharing, so you do need a clear purpose. And you can expect trade-offs also when you are considering sharing the data. So there may be a risk to privacy that would have to be considered, and it would have to be addressed if in a health governance situation would have to be addressed and covered off in order to share the data safely and securely. And there would be a need to balance goals. So you may want, for example, and I can just give you an example from the Indigenous context where there's two jurisdictions involved. There's federal and provincial. Well, it would be nice, and we've heard very, very often, if a client's file could follow them if they leave their community and they go into a city, for example, so that the providers in the city could know the history and they could know the needs of this particular client. Without an arrangement in place, though, you want to be careful that there's not a privacy concern that's being violated, that there's not concerns about the First Nation that's involved that are violated. So there's a trade-off and a need to balance goals. Next question, what kind of ethical principles should apply and predominate? What is the most important principle at play here, or which ones have to be balanced? So is it very, very preeminently important to be transparent? In some contexts, you might want to ensure efficiency. We're talking here about health equity. In the Indigenous context where I work, we talk often about self-determination too. So self-determination with regard to data for First Nations has certain implications about the kinds of model you would want in a particular context as opposed to another. And less than ideal, of course, is the situation where a government body is holding all the data and the First Nations themselves cannot access it, and they would like to see that turned on their head or shared at very least. Another consideration, the applicable acts and regulations. It's very important to get legal advice if you're considering sharing a data set, and this advice will help you understand both your limitations and your latitude as you negotiate any sharing agreement. And very, very important in dealing with community groups in particular is recognizing early on and addressing any imbalances in power and capacity in the event that you're sharing data and that you have a partner in the governance of the data who has less capacity than your organization itself, fewer lawyers, fewer practitioners who are familiar and versed in using the data, fewer IT people. It could have a whole range of implications. But the model chosen, it's very important that it's usable, I guess, by your partners in the governance of the data, and that this be recognized and addressed early on. In a health context, there's strong grounds, I think, for moving away from the right-hand pole of a data hierarchy in some cases, and more towards a partnership and a co-governance model. Once again, though, there are cases where it makes most sense to just, have and use your own data. And it really depends on what type of data, why it's needed, and what degree of control is fitting in that particular context. Okay, last slide for this presentation. I tried to point out some examples that exist already. Just turning to the last slide, perfect. In the Indigenous health context, and some of you I saw are in British Columbia, and you're probably aware of the First Nations Health Authority, which is a First Nations-led organization of 203 First Nations at the governments of BC and Canada, and in 2010, as part of their overall tripartite relationship, they signed a data quality and sharing agreement which had been, based on my interviews with the First Nation organization, had been requested by the First Nation party to ensure that there would be appropriate use of the First Nations client file to monitor the health status and program performance. And the First Nations client file was developed in partnership, like it was developed based on Indian registry data, coupling that with some health data from BC. So there was something brought to it from both sides that made a more robust view of the client, but on the other hand, there were privacy concerns that were raised by the First Nations parties, and they wanted to ensure that it would be covered off in this sharing agreement. So that is available online, and it's under the link that if you go onto the slide itself, then you can find a link to the website there. The second one is a tweaking partnership of the first of initially five First Nations. Now I think it's more. The governments in Nova Scotia and Canada, and they did something similar. They created a client registry, linking the registry data to provincial health data sources for participating Nova Scotia First Nations. And they've done some really neat things with the information they've received through using the client registry, and they have some great publications up there. And once again, there's a link to their story, and hopefully they'll be able to tell it themselves at some point, and what they've been able to do, and the with working together, the sort of challenges they had to work through, and the rewards that came at the end of it. And the third one is an example, not of a partnership in this case, but an actual kind of common situation. And this is from Australia, and it's a data archive that, for reasons of seeking to avoid, there's sort of fragmented data collections on the Aboriginal people of the area that they wanted to bring into one place and to put in place appropriate protocols set by the Indigenous peoples there themselves in order to access it for a researcher to be able to use the data. And as far as I know, that archive, I just checked, it's still going, it's still getting uploads, so communities or researchers with permission of communities can upload entire data sets for use by others, again, guided by certain conditions that are put upon the use of those data sets. Now, I did have a question here from, or just an observation from Terry Smith, talking about the fundamentals of First Nations data ownership, data and information governance principles, which are the OCAD principles. And Terry's comment there, I don't know if everybody can see the comments. This is a new format to me, but it's beautiful. It just gives you a sense that there is a set of principles. These are ethical principles developed by First Nations called the OCAD Principles: ownership, control, access, and possession. And they were developed in a specific context of regional health survey that was conducted by and for First Nations starting in 1992 and then progressing through to the present. And it stands on data and governance, or data governance and information governance, that issued from a group of people that is a marginalized group. And this is their position on how data ought to be owned, managed, and used by involving First Nations. So it's not my story to tell, the OCAP story, but it's an excellent one. And it's an important consideration in working certainly with Indigenous groups from coast to coast to coast, although they're applied in different ways. The OCAP principles are frequently invoked by all First Nations groups across the country, and I think it would make a story in itself to discuss with some of the organizations how they have managed to bring health equity into their data governance relationships through the use of the OCAP principles. So on that note, I think I'll end my part of the presentation with great apologies about the technological difficulties, and we can turn to some questions, hopefully. Last slide, Ashoka.
Thank you, Jodi, so much for that really excellent overview of data governance principles and the various models which are in use in the field, as well as those examples. So I think you just mentioned the Toucan Partnership. We are in conversation with them about sharing their work with us, so we're hoping that we'll have them on our webinar like this in a couple of months. So stay tuned for that if that is of interest. But yes, they do have tons of information on their website, and we hope we can hear from them directly in a very short while.